Hello everyone. This mini lecture is on Xiao Yao San, also known as Free and Easy Wanderer. The formula is from the Cal formula list. I will summarize the pattern, a short patient case, 3 clinically important drug-herb interactions, and a practical management plan. Traditional use. Xiao Yao San belongs to the category Soothe Liver, or tonify blood, and Spleen. The formula is selected by pattern, not just by disease name. In this presentation, the goal is not to prove that herbs replace medication. The goal is to show how a practitioner thinks about benefit, risk, and communication with the patient's physician. Case patient. 45-year-old female with stress, PMS, mild depression, hypertension, and headaches. Medicines. Sertraline, hydrochlorothiazide, and ibuprofen as needed. The pattern diagnosis is liver qi stagnation with blood deficiency and spleen deficiency. Tongue pale red with thin coat, pulse wiry and thin. This gives a reason to consider the formula, but it also creates the need to check her or his medication list before recommending treatment. Interaction 1. Gancao and hydrochlorothiazide. Mechanism. Licorice can lower potassium and raise blood pressure. Thiazide diuretics also lower potassium. Clinical significance. Moderate to high, if used long-term, or in a hypertensive patient. Management. Identify high-risk patients, avoid duplicate herbs, and monitor symptoms and objective values when relevant. Interaction 2. Dangui and ibuprofen or aspirin. Mechanism. Additive antiplatelet effect may increase bruising or GI bleeding. Clinical significance. Moderate. Risk rises with daily NSAID use or ulcer history. Management. Counsel the patient on warning signs and coordinate with the prescribing clinician if the medication has a narrow safety margin. Interaction 3. Chai Hu and liver metabolized drugs. Mechanism. Bupleurum is biologically active. Possible CYP or liver stress concern in sensitive patients. Clinical significance. Low to moderate. Evidence is less certain, so monitor. This interaction may be less certain than the first one, but uncertainty is still important because patient safety comes first. Management plan. Use a short 2 to 4 week trial, avoid extra licorice and NSAID stacking, monitor blood pressure, potassium symptoms, bruising, and mood changes. I would also document the formula, dose, product brand, start date, stop date, and all current medications. If red flags appear, the formula should be stopped, and the patient should contact the physician. Conclusion. Xiao Yao San may be useful when the pattern fits, but the safest clinical approach is a short monitored trial, clear patient education, and communication with the physician and pharmacist. Thank you.